Today, I have something very important to share as I am experiencing dementia and Alzheimer's in my family. We have an amazing guest today, Dr. Millie Frantz.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening, everyone. I am your host for Senior Care Made Simple podcast, Andrea Albertini. So today, we still don't have Doris Moscarella. Don't worry, she will be back. And we missed her today, but that's okay. We have an amazing guest today. Her name is Dr. Millie Frantz. Hello, Dr. Frantz. How are you?
Hello, Andrea. It's so good to be here. And hello, everybody that's listening.
Well, we have people from all over the world chiming in and listening to our podcast. And one of the reasons I brought you here today was because I know that you have an amazing book, which is called The 10 Steps to Care for a Loved One with Dementia, and has strategies, support, sanity savings, tools, and overwhelmed caregivers. Now, I wanted to tell you because you and I know each other personally for a very long time.
Yes.
Right? And so I had my own share. About a month ago, I went to Brazil to see, you probably know a little bit about my life, but I was adopted by my grandparents, my fraternal grandparents. And one of my aunts who never had children, she kind of adopted me. I was that kid that she took care of her, even though I stayed during the week with my grandparents. But she's the one who put me in boarding school. She's the one who paid for my education and all that stuff. So I guess I have been avoiding going to Brazil for a long time because I have heard that she had Alzheimer's dementia. And I don't think I could cope with it. Even though I am in home health, I see it all the time. I hear it all the time. I talk to families. I hear my caregivers. I hear my employees. It's not the same when it happens to your loved ones, right?
Absolutely.
So I finally decided I was going to go to Brazil to see my aunt, who is completely bedridden, on diaper, skin and bone, and she just stares. So she has the front lobe dementia. And that experience was the most saddest experience I have ever gone through. And I had to sit there and hold her hands and said, if you remember me, I'm practically your daughter, your niece, but I'm your daughter. If you can just remember me, just squeeze my hands. And she did squeeze my hands, and she had tears in her eyes, and she took one finger and just did this to my face. So anyway, I'm sorry I'm getting emotional, but so I had my own experience, and you're here today to share your experience dealing with your father. So please share it with us.
Thank you. So it's affected several members of my family. My grandmother had dementia at the end of her life. My stepmother had dementia, and now my father. And quite ironic that while I was writing this book about how to care for someone with dementia, my father, I diagnosed with dementia, with Alzheimer's. So it's hit my family in multiple ways, but also all of my patients. So, I can learn the science through medical school residency, journal articles, but my patients always teach me just as much as anything I could learn in a book. And they've taught me a lot, and their stories have taught me a lot, and my own stories. And yes, I'll probably get emotional during this too.
Sure. Well, you have been an amazing, incredible primary care physician, right?
Yes.
And in Monmouth County, New Jersey. And I know that you spent a few months in Palm Beach during the winter. And I know that your father is here with you, and then we care for him.
Yes,
which we're very honored to care for him. And I'll tell you, going to see getting in your family, having this in your family, it affects everybody. And this particular aunt of mine that's taking care of her, she hasn't been married either. She never got married. She's an OBGYN. And she was looking forward to retire and travel the world, right? And have fun. And she's very proper. She loves opera. She loves books. And now she's the one who's taking care of my aunt. Even though they have money, right? Is still finding someone in Brazil. The way we have the care that we have in U.S. is completely different. So share some of the stories, share some of the things that you are going through or that you would like the listeners to understand when it comes to caregiving, when it comes to dealing with it. Acceptance is a big thing as well.
Yes, I was thinking about that this morning, about what do I want to focus the most on? What do I want people to understand the most? And I think the biggest thing I want everyone to understand is they're not alone in this journey, and they can't do it alone, because people try, especially spouses. They make promises to their spouse. Don't worry, I'll never put you in an assisted living or a nursing home. Don't worry, I won't let anyone come in and see you looking like this. But you can't do it by yourself. You've got to have support. And that's part of what I talk about in one of the chapters in the book, is to pre-plan that. Like make a chart. Who is your support system? And your closest support, your family, your spouse, your siblings, your parents, depending on who's the caretaker, and your friends, your close friends, your cousins. I mean, write them all down, because it's going to get bad and it's going to be sad, and you're going to be lost. So if you are prepared in advance of who your support system is, then it's easier to go to. I talk about the rings of support, the really close people that you can ask anything of. And then the next ring, maybe that's your caretaker, maybe it's a therapist, maybe it's an agency like yours, because that is a lifesaver, let me tell you. I thank you so much. Anyone dealing with this, if they come to Horizon Care Services, I mean, my dad is so happy with the caretaker he has, which makes my life easier, and it's really freed me up to relax a little bit about it. So you've got to have help. You just can't do it on your own.
You cannot do it on your own. And, and even with my aunt now, she does have some help, but she doesn't have the structure. My town, Victoria, they don't have the structure that we have in U.S. and how lucky we are to be here, because I have had many, many families, a lot of caregivers end up passing away before the patient does.
Right.
Because of the amount of stress
yes.
that you go through dealing with it, understanding. And, even though you understand as a caregiver, but their behavior sometimes, you forget that they're sick. You forget that what's going on with them, and you take it personally, and it affects you. And those are the things that I think that dealing with that, people have to learn. So what have you been your experience with that?
Yes. So I do tell all of my patients that are caretakers, and through the book, I talk about forming your circle and forming time for yourself, even if it's a few minutes a day, to go outside, walk around the block, have somebody come and sit for 15 minutes, half an hour with that loved one, so you can just breathe a little bit, get outside in the fresh air. I mean, we're lucky now compared to when my grandmother, my mother, my stepmother went through this, compared to now with my father, because technology has come a long way. So there are a lot of technological things that I use, and hopefully somebody, and that's something you can delegate. Okay, let's say your sibling is out of state and she says, well, I can't be there. Okay, but you can do the technology things, or you can go online and pay their bills. You can check this, that. So you've got to assign them jobs. Everybody sort of wants to help. You always hear like, oh, if there's anything I can do for you, let me know. But you can't let it end there. You have to say, you know what? Could you go pick up their prescriptions from the pharmacy for me? Every Tuesday, could you drop off a casserole? Have a list ready, because if you don't, you're just sort of like, okay, I'll call if you need something. And then it never gets done. So make it concrete. Tell them exactly what they can do to help you. But the technology we have now is really beneficial. For instance, tracking the person. Okay, I've been tracking my dad through his telephone for a couple of years now, so that if he goes out and walks and he gets lost, I can look and see where he is. I can guide him home. They have pads now that you can put on the bed or on the chair that are weight related. So if the person stands up, gets out of bed, you can get an audible alert if you live there, but otherwise you can get an alert on your phone. So that's something somebody out of the area can do.
Absolutely. Amazing tools. Amazing.
I have something right now that I love for my father. It's called Jubilee TV. It's a little box that I connected to his television. It has a camera on it, and it connects to my phone. It syncs with my phone real time. So I can see what he's watching on television. I can change the channel. I can put the volume up and down, and I can see him through the camera. I can talk to him through the television. That is really an amazing piece of technology.
That's amazing. I never heard of that.
Yes, it's brilliant, and that has really helped me a lot, because he was no longer able to use his remote. He couldn't figure out all the buttons, which is so sad, right? I mean, my dad is an engineer and he's a very logical person, but this is the disease. This is the sadness of this disease. So there are so many things now. There are wander bracelets. There are falling down bracelets. I mean, there's so much with technology. So if it's a wife of a husband and they're both elderly, then let somebody else take over all of that techno stuff that can help them.
Right.
That's something that somebody can do for you, because you just can't do it alone.
Absolutely. And that's one of the things that I have stressed many, many times over. You know, my husband had a little bit of dementia towards the end, and I know how hard it is. Of course, I had 24-hour care for him, and I was still working 60 hours a week. But even with all the support that I had, you know, owning this agency for almost 22 years, we're going to celebrate 22 years this year.
Yay!
With Horizon. I'm so excited. I'm so grateful for everyone who has supported our business for 22 years. But, you know, and even with all the support that I had, you know, I had a therapist once a week that I talked to. You know, of course I take clients out. So I do clients for happy hour. So I kind of still try to live my life. But again, you know, when you come back home, you're still going back to, you know, to suffer and seeing that person, you know, that you love deteriorating, you know, every day.
That's right.
You know, so even with all the support that I had, you know, I still suffer with it. So if you have none, you know, it's dangerous for you.
And it is suffering, Andrea, and grieving.
Yes.
While the person, you're grieving their death, and the death, I call it grieving the death of a dream, because you've all have your plans of what retirement's going to be like, what older life is going to be like. And once that person has dementia, you're grieving them, you're grieving the death of the dream. You're grieving what your life is going to be like, all tied up with this. You know, no more travel, no more going out with friends as a couple. So it's really grieving and suffering. And that's, again, and I'm sorry if I keep harping on this, but it's another reason why you just can't do it alone. You just can't process it alone.
You just can't. And I really suggest even they have support groups. You know, a lot of the neurologist groups have support group. You can just Google support group near me, support group for Alzheimer's care near me. Go to a support group, even if it's like 1 hour, you know, an hour and a half that you can talk to other people. Because believe it or not, it's like, you know, a lot of people go to AA, you know, a lot of people go to those support groups. You know, Alzheimer's Dementia also have an amazing support group where you all going to be sharing, you know, what you are going through. And I think that all of us have a little bit of insights, you know what I mean, to be able to share with others. You know, like you have your insights and someone else have the insights, and you can learn from that group. You can learn from one another and be able to be that support system. It is so, so important.
Absolutely. In the book that I wrote, at the end of each chapter, I asked a caretaker to write a short letter about their experience, an experience of taking care of their loved one, and then a very short couple paragraphs of what they would say to their loved one about how much they love them, about what their life meant to them. And you can get that through support groups also. Those, as a matter of fact, I'm going to start a private Facebook community that people can join if they're caretakers for dementia, where things like that can be shared. They can put out what's upsetting to them. They can get answers back from everybody about what worked for them.
Right. Now, one other thing that I wanted to ask you, because I went through on my own, when I'm sure you have the power of your paperwork for power of attorney, right?
Oh, yes.
Healthcare surrogate.
Yes.
At what point did you make a decision to say, okay, there's something wrong with my dad? And as a physician, of course, you knew what it was. And okay, now it's time for me to get to an attorney and get my paperwork in order. Can you please share with the listeners about that?
Certainly. Well, with my father, it was easy because he was such an organized person. I mean, he had binders full of what to do if something happens to him. I always hated that when I was younger, like, here's this book and here's everything and here's what you do if something happens to me. I'm like, oh my God, please don't talk about it. But as he aged and as I aged, I realized that is an important thing and we have to deal with that. So he was very organized, very logical, had it all written out for me so that I didn't really, he already had the power of attorney, every document that you could have way before he got sick. But I do tell my patients that as soon as there's any inkling that person has dementia, you need to go take care of all of the legal stuff before they get too bad where they're considered incompetent of making those decisions. So it's really important, and it's not that bad, really. If you sit down with an elder care attorney, they can tell you exactly what you need to do, have the papers all drawn up, signed, and then that's it. Then you're done with that.
Yes, one of the things that happens, and it happened with me personally, but it also happens a lot, in our business. From time to time, we have clients that come to request our services, or the physician requests the services, and we find out that they have a little bit of dementia, right? But they don't have a healthcare surrogate. They don't have guardianship. And that can cause a lot of problems for them and for us, right?
Absolutely.
So we, as an agency and as an advocate, because we do have an advocacy program, we have a care management program, we have a lot of relationships with different attorneys in the area. And we recommend, before the patient gets so bad, we recommend that they go seek an attorney and take care of those legal issues, because we are going to be the caregiver. So we need to be able to know who's the power of attorney, who's the guardian, who we need to talk to. And, and it gets very, very, very complicated for us to care for them. So I always recommend that, as you see in your parents, aging, and also, feeling like they have a little bit of dementia, confusion, jump on, get the power of attorney papers, get your healthcare surrogate papers so you can better care for your loved ones. Because in the state of Florida, if you don't do that and something happens and you end up being picked up by police because you don't know how to go back home, or maybe you have an accident or something like that, you're going to be warded of the state.
Yes, it really is important. And some people don't like to do that part because it makes it real. All right. When I give someone the diagnosis and I say, you need to do this, this, and this, and one of those things is to meet with an attorney and get that done. But it's really hard, even though really by the time I give the diagnosis, they probably know. But when I say it out loud, it's real. And that's difficult. They have to come out of denial land, I call it, and face what's there. But it is extremely important, just what you said, that in the very beginning, if they haven't already done it, I mean, really, we should have these conversations with our parents way before they're 80 and way before they have dementia. But if you haven't, then as soon as there's an inkling, even before the diagnosis, you definitely should take care of the legalities.
Absolutely. And actually, I recommend, because I am such an advocate for anything and everything and everybody, including animals. Sometimes I'm driving in Juno Beach and there's a turtle crossing the street. I put my car in the middle, stop traffic, get out and pick up the turtle. And here comes the police. You can't do that. But anyway, so I just wanted to throw out there, I'm such an advocate, and I love life, and I love people, and I love animals. But one of the things that I see that is so important, I think everyone that has elder parents, anyone, I don't care if your parents are 50, 55, 60, if you still have your parents, you need to talk to your parents about guardianship and about power of attorney and all of those things, just in case something happened. Because we have a patient right now that had a stroke, and the husband is a lunatic. We probably put 15, we have the best caregivers in South Florida. We'll run out of caregiver to put it there. 15 caregivers went through him already. He's just very difficult. He takes good care of his wife, but she had a stroke and she's completely bedridden, right? And the children has no power of attorney, has no health care surrogate, have absolutely nothing. You know who's suffering right now? Their mother, yes, because the father is just being very difficult. So it is important. I would love for you to share a little bit more of things that's in your amazing book.
Thank you. Well, one thing I would like to share is that even though it's a difficult journey, you have to find little moments of joy in that journey, because they will pass also. So whatever you have with that connection with that person, enjoy it for the moment, because soon you may not have that part. And so just try to find time in that really difficult thing that you're doing, even if it's 5 minutes a day, 10 minutes a day. Maybe look at pictures, family pictures together, whatever can stimulate their memory. If they're past that already, just put some lotion on their hands, feel their touch. While they still know your name, have them, again, technology's great now. We can record their voice. We used to not be able to do that.
Yeah.
When my grandmother was gone, she was gone. Luckily, I had a couple letters that she had written that I saved. There were nothing special about those letters, except they were her handwriting. So when I look at those, it's so touching to me. But now we can record our loved one's voice that we can save later. But it's a very grueling, terrible journey. And yet somehow before it's gone and you're like, oh my God, all there was suffering for the last few years, you've got to find some joy in that time for yourself, with that loved one, with other people. Because also your own health will be hurt. So you've got to still find time to exercise, to eat right, to get out, to have a laugh with your friends, or else your life is just passing you by. And at the other end, a big chunk of it went by and all you're left with is sadness. So you've got to find those moments of joy in all of that hard work you're doing.
Absolutely. And actually, I didn't think that my aunt was going to remember me, because she's been like this for about 6 years, and it was almost like, she was like waiting for me, to go. And I mean, it was just what an experience it was. And she does recognize my other aunt a little bit, but she just stares, I mean, that to me, her remembering me, that was really emotional for me. So I'm glad that at least you were able to enjoy your dad.
Yes.
Which is really, really important. And again, all of you that are dealing with this right now, please, please, please buy this amazing book, 10 Steps to Care for a Loved One with Dementia. You guys, I don't promote a lot of things on the show, but this book is really amazing, especially that have touched my own family. And I had my own experience with it, with my aunt. I can't believe this most beautiful. She looked like Jackie O. Blue eyes, beautiful hair, and her Jacqueline Smith hair. And to see her laying in bed, just, skin and bone and diapers and can't remember anything and barely any hair, that was just devastated for me. But I enjoyed the time I had with her there. And even though it was a short trip, it was a very enjoyable time. And I know that probably I won't be able to get back there, anytime soon. So I understand.
Yes.
So Dr. Frantz, where can people find your book?
Yes, right now they can find it on Amazon. And probably the easiest way to get to it is search my name, Dr. Millie Frantz. And then the books that I've written, I'm writing a 10-step series. So they'll pop up. You can choose that one and order it through Amazon.
Also, thank you so much. You gave us one copy. We're going to give a giveaway in a couple of weeks. So if anyone are interested, please email us at seniorcaremadesimple@gmail.com. seniorcaremadesimple@gmail.com. Also, too, I know that you have another incredible book that's called The 10 Steps to Reduce Your Blood Pressure. That is an absolutely incredible book.
That's also on Amazon. So that's why I said if you look up by my author name, Dr. Millie Frantz, then both books will pop up. And there'll be a few more in the pipeline right now, so I'll let you know when they're ready.
That is so exciting. Thank you so much for joining us today. We hope to have you back in the show again. And please, you guys, take a look at those books. They were absolutely amazing. She's an incredible physician. I know her for a long time. I'm not trying to be favor. I'm just saying. And we love to have you again. And for everyone, have a great day. And stay tuned for the next episode of Senior Care Made Simple podcast. Goodbye, everybody.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.